Thinking Aloud. Conversations on the leading edge of knowledge and discovery with psychologist Joffe Mishlove.
Hello and welcome. I'm Joffe Mishlove, and this is part 2 of our 2-part series on rational emotive behavior therapy. With me is Dr. Debbie Joffe Ellis, who is the wife of the late Albert Ellis, the founder of REBT, as it is known, and co-author with her late husband of the book, Rational Emotive Behavior Therapy, and also co-author with him of his autobiography, All Out. In addition, Debbie is an adjunct professor at Columbia University Teachers College. Welcome again, Debbie.
Great to be here again, Jeff.
It's a pleasure to be with you. We talked in our first interview a lot about how rational emotive behavior therapy teaches us that we can get through anything that life might throw at us. Nothing, even death itself, as you experienced with your husband, is a natural process. That it's not as if you survive death, but you don't have to make yourself crazy, even if you're dying.
Indeed, yeah. I mean, if one visits a hospital or a nursing home or a community of the elderly, you'll see some individuals who have a brighter, more optimistic outlook about life, or they focus very much on day-to-day and not long too much for what has been and gone, and not stress about what will be. And those people with an attitude of accepting what is and focusing on what's good, while accepting the inevitability of life containing some suffering and loss, are the people that have better lives.
Yeah. And to help people get through their difficulties, you could say their neuroses, or the things that drive people crazy or a little bit crazy, you focus largely on disputing irrational beliefs.
Indeed, yeah. Al, in his genius, came up with a very simple ABC formula. I mean, simple for those who use it and apply it, effective for those who continue to apply it. And the D for disputing is the fourth element of it. But the premise of REBT, as I mentioned in our first interview, is that it's not the event, it's not what happens that creates our disturbed emotion or our disturbing emotion, but what we tell ourselves about it that creates the disturbance.
And you often see people going through identical events who have very different attitudes.
Indeed, and with their different attitudes, they will experience a different emotion, and their flavor of life is quite different. You know, the people that one will attract can tend to be more healthy, positive, life affirmative people, and misery often attracts misery. So it serves us well to start with ourselves, which really, we only have power over our own emotional destiny. We cannot control that of other people. Others only change if they choose to change. We may be an influence. And you know, the 3 core irrational beliefs from which a multitude of others come and lead to a person creating disturbed emotions such as depression, anxiety, shame, guilt, jealousy, rage, are, number 1, I must do well and be approved of. You must treat me well and act the way I think you should. And 3, life should be just and fair. And when we think in those ways and we don't get what we want, or we do get what we don't want, then we will tend to create a debilitating emotion, emotion that interferes with our more healthy goals in life. And so you mentioned a few minutes ago the disputing as being so very helpful, and which is part of what makes REBT such a substantial and elegant approach. It doesn't just say change your thinking. It says first identify the thoughts that are hurting you, dispute the life out of them, zap them, and then come up with healthy, effective new beliefs and philosophies.
Well, let me interject a little bit from my own background. I have a background in parapsychology, and the founder of the modern era of parapsychology is J.B. Rhine. He did a lot of good scientific research starting in the 1930s at Duke University, but it was met with a lot of hostility. Rhine actually sought psychotherapy because here he thought, I've made a great scientific breakthrough and people should be praising me. Well, some people were praising him. But he was terribly disappointed at the reaction, the hostility that he met, because people weren't ready to accept the data. So this would be a case in point for REBT, wouldn't it?
And also what you described, you could replace his name with the name Albert Ellis. Because when Al first presented REBT to his peers at the American Psychological Association convention, huge event, it was in Chicago that year, 1956. Before I was born. I love saying that. Makes me feel young. He was booed and jeered and called stupid and superficial and simplistic because the dominant approach then was psychoanalysis.
Yes.
You know, you could say Freud was the lord.
Yeah, Freud's a deep, unconscious problems that have to be brought to the surface through years of psychoanalysis, and Al basically rejected that.
He did. I mean, his training was in psychoanalysis, and he was a very good one. But as he practiced with his clients, he saw increasingly that though many of them felt better after a session and talking and all, they weren't getting better. They were continuing to think and act in ways that created emotions that dampened their quality of life. And so bit by bit in his psychoanalytic practice, Al introduced homework. He became more active directive. Bit by bit he was formulating and writing about the approach that was to become first called rational therapy, then RET, rational emotive therapy, which it was when you first interviewed him.
Yes, that's right.
And in 1993 he changed it to REBT, rational emotive behavior therapy, to reflect how holistic the approach is and the premise that the emotions and the thoughts and the behavior are interconnected.
And like J.B. Rhine, he had to contend with the hostile critics.
Great hostility. And part of REBT that helped him was not needing their approval. Of course he wanted it. Of course it feels more pleasant. But if you need something, you're desperate and you don't get it, a person can make themselves depressed or anxious or both, devastated. When you want it, which is healthy, but don't get it, one doesn't like it, but is not debilitated and doesn't waste energy on woe is me and it's terrible and awful, and just continues on their path of doing what they can to bring their goal to fruition. In Al's case, he knew his approach worked with many people. And despite his peers, with probably a few exceptions, but very few, going against him, he didn't let that stop him. He went forward, and now the cognitive approach is the most widely used approach in psychotherapy. If Al had needed approval and been damned the way he was and just, went back to his psychoanalytic practice or whatever, the world would have been very deprived of his knowledge.
Well, did he use particular techniques when he was faced with all this hostility?
Indeed, reminding himself that he doesn't need what he wants, he just wants it, that he can stand what he doesn't like, he just doesn't like it or didn't like it, that approval of others isn't necessary, that if one has firm conviction It's not that it's not helpful to listen to criticism from others, but not to change oneself in order to get their approval, to change if one ends up agreeing, hey, they have a point here. But in Al's case, he continued to believe that his approach was more effective for more people more of the time. It could be used successfully for many as a short-term approach. For others, for example, people with OCD, they benefited...
Obsessive compulsive disorder.
Yes, benefited from ongoing therapy, sometimes individual therapy, sometimes in groups. But one of the components of REBT is that of psychoeducation. And if a person comes for therapy, group or individual, they're taught the principles. And what's most important is not what happens in a session, but that the person is motivated and willing to do homework, to practice what's recommended, what the client and therapist collaborate on and agree on is for the client's benefit, that they practice it in between sessions, in their daily life. Because REBT reminds us that to maintain therapeutic gains requires ongoing work and effort. It's not hard, it just takes application.
It's not enough, in other words, to just attend a 1 hour a week therapy session.
For some it might, well, that's a good start. But yes, it's not enough just to go for therapy and then go back to your old habitual ways of thinking and acting. Then one wastes an hour on therapy and will hardly change. It takes action and change ongoingly, and that includes, and what's really important in REBT is to be willing to embrace our fallibility, and that often in life, whether it's in therapy or any other pursuit, there'll be relapse. And that's not terrible, it's not awful, it's just relapse. And to be willing not to damn ourselves, just to, as the song goes, pick ourselves up, brush ourselves off and start all over again. But literally, many people feel discouraged when they start therapy and there's progress, and then they relapse and can wrongly talk themselves into believing this isn't for me, I can't do this, and give up too quickly. And one of the roles an effective therapist can play is of an honest encourager and motivator.
Well, there are many other techniques. One of the important ones is in vivo desensitization.
Well, Al practiced that on himself because, to quote him, he was in love with 113 out of 100 women. Go figure, scientists. And but as a teenage lad, was terrified, suffered from debilitating anxiety and shyness.
Around women,
and also connected with public speaking.
In fact, most people are afraid of public speaking. So I understand the research shows that the fear of public speaking is greater than the fear of death.
I've read that many times. I find that rather sad and astounding. It's not that I disbelieve it, but look at that. It matters so much what other people think of them. That people with this kind of fear can restrict themselves and deprive themselves of what may be a very enriching life experience. It's very, very sad, and one of the umpteen reasons I love REBT, because it can do a good job for a receptive person to help them talk themselves out of that self-restriction of I can't do it if I do a bad job, and what if they think I'm stupid, and what if I'm rejected? And so coming back to Al, certainly his shyness and fear of rejection were largely at the heart of why he was afraid to talk to women, or why he was nervous about public speaking, even though he was elected as president of a college political group. He was always into justice, fighting for justice. So he read the work of John B. Watson and how
the founder of behavior psychology.
Indeed, and he successfully helped some children who had phobias about little animals get over them by gradually exposing them, bringing the animal closer and closer over a course of sessions. And so Al thought, if it's good enough for the little kiddies, it's good enough for me. Let me give myself the homework, he thought, of talking to 100 women in the Bronx Botanical Gardens, that was near where he lived, over the month of August. And if I die, I die. I mean, he pushed himself, here's a core part of REBT, to do uncomfortably what he wanted to get comfortable at. So he spoke to 100 women, made one date, and she didn't show up. But he got over his terror of talking to women because he had nice conversations, nothing terrible happened. And similarly with public speaking, he forced himself to do it and found in a short time that not only did nothing happen, to quote him, he had a quaint way of saying things, and I'll leave out the more crude things he would say in this story, but one thing he said was, no one ran away out of the room being sick. He found that not only did people find his public speaking of interest, but that he enjoyed it, that he was good at it. And if he had let that fear dominate him and deprive him from trying it, you know, millions of people would have been deprived of hearing him speak about an approach that's not only a therapy, it's also a way of life that has literally saved the lives of people and enhance the quality of countless thousands more.
Well, I suppose you don't need to be mentally ill to benefit from these principles.
Definitely not,
no. And in fact, I know there are many weekend workshops people have put together, often without acknowledging the influence of Albert Ellis, but they're based on REBT.
It's clear, you know, REBT first came out with Al writing about it in 1955. He spoke at APA, as I said earlier, in 1956, wrote many, many books. There are 85 published books out there, nearly 2,000 published articles out there, countless more chapters in books that Al contributed to larger textbooks. And so really Al, as I indicated before, pioneered this approach, and then many others followed. Cognitive behavior therapy, the approach that Dr. Aaron Beck is the father of.
Very similar.
Very similar. Well, they were in communication. You can read letters.
And Beck acknowledges his...
And Beck acknowledges Al's influence
and
in his life.
you've also mentioned the whole discipline, which is very popular now, of positive psychology, is in many ways an outgrowth of REBT.
Martin Seligman, who's considered one of the fathers of positive psychology, also respectfully acknowledges the influence that Al's work had on his approach. So indeed, there's acceptance commitment theory, DBT. Coaching has at its root. I've heard television evangelists talking about the ABCs, and so many people don't acknowledge the REBT influence, some respectfully do.
Now you used the term, the ABCs, we better define it because it is very specific to REBT.
Indeed. So the ABCs of REBT, A stands for the activating event, the thing that happened which appears to have created the unhealthy emotion.
Yeah, and many people figure if I feel bad, it's because X happened. And what you're saying is, no, there's the B.
It's the B, which stands for beliefs, or Al used to say the, may I say bullshit? The bullshit you tell yourself. I've said it, right?
Yeah.
And so first one identifies the A and then clarifies the C that is not helping one, the consequence. C stands for consequence. Mainly one looks for the emotional consequence, depression, anxiety, rage, shame, jealousy, guilt. But there also are often, not always, behavioral consequences. So they too can be attended to, but usually first the emotion is prime. And then we go back to the B and identify the irrational beliefs, looking for the shoulds, the demands, the absolutistic thinking, the self-damnation, the damnation of others, or saying all of life is bad because this happened, taking things too seriously. And the person writes down as many irrational beliefs as they can identify. Whether they can consciously remember thinking them, in many cases they won't. But if they self-examine, they will in all honesty, identify at the core, I believe I shouldn't have to deal with this, or you shouldn't talk to me like that. And you write them down, and then D is the disputing, where you question, where is the evidence for that belief? Is it helping me or hurting me? Is it logical? Does it follow from my preferences that it should be this way? And so dispute, dispute, dispute. And then the E part of the ABC stands for effective new philosophy or new beliefs, where one comes up with beliefs that are counter to the unhealthy, irrational ones. For example, I can stand what I don't like. I just don't like it. Life does contain some injustice, but it doesn't mean everything in life is unfair, and so whatever pertains to the A, and then a crucial final part of the ABC process is homework, whether one is giving it to oneself or in a therapeutic session, that one gives oneself the homework for at least 30 days. It might be of doing an ABC every day for the next 30 days, or talking to a person in a coffee shop if you're trying to get over shy.
Yeah.
And interestingly, you know, the visionary that Al was, and by the way, he was a genius. He was a member of Mensa in the highest percentile of IQ, along with Einstein. And some of the things he asserted without having the scientific backing to prove it. And now, you know, neuropsychology research and that pertaining to plasticity supports that which decades and decades ago Al came up with, for example, a minimum of 30 days of doing homework.
We're even looking these days at genetic plasticity.
Indeed, because research shows that is a period of time where indeed changes in the neural transmissions take place. So it really, REBT is incredibly effective for people who apply it on a daily basis. Most people, most of the time.
Well, and there are hundreds of techniques when you actually get into the therapeutic process, because there's so many different conditions that people will bring into therapy.
Indeed, but we can narrow, or we can divide them into three broad categories of homework in REBT: cognitive, emotive, and behavioral. And some of the techniques are a combination of two or of three of them. But the goal is to encourage the person, the client, or whoever it is that one is sharing REBT with, to take action. Not forgetting the importance of compassion for self and others, not forgetting the importance of daily gratitude, even and especially when things are very tough, to take time. You know, when my husband was dying at the end, he knew his health was failing. Well, so did I, but he accepted.
But he was in his 90s.
He was.
And still living. He had lost his large intestine completely. He had a feeding tube.
For the last 15 months of life.
A feeding tube in his mouth. He couldn't eat. He was experiencing uncomfortable, terrible itching.
Agony.
He was in agony, and yet he still found within himself the presence of mind to work with patients and to work with students.
Indeed, they would visit him in the hospital, or you know, we'd be in hospital and he'd get a bit better and go into a rehab place with the goal of getting back home, and then there'd be a relapse. So the last 15 months of his life physically it was like his body was a torture chamber, and yet through his willpower he would welcome students who reached out to me, you know, can we come visit Dr. Ellis? And even in the hospital, when he recognized a doctor or a nurse that he got to know after a while was suffering from, he would even recommend things to them. You know, Al's main doctor said he had never met a person of Al's age or any age in such grave ill health, with the ability to reach out to help others, mostly someone in such discomfort. Understandably, it's not a criticism. is
They're
more
self-absorbed.
Understandably, but not Albert Ellis. And so in our final months, he's losing his health. He knows that which he wanted so much in our work life, to regain control of his institute.
Yeah.
You know, which that's a whole long story, but it didn't happen. He accepted that wouldn't happen in his lifetime. It was the most difficult period in our life, and yet every day we focused on how grateful we were to be together. That was the only thing I would say that was good in our life at that time. And so we would hold each other's hands. If he wasn't too much in physical pain, I would lie down in the bed next to him. We'd just hold each other and focus on our love and focus on what was good. And that's why, you know, to answer something you brought up earlier, even in the most dire circumstance, if we're willing, we can choose to focus more on what is good, even though it may look like it's that much compared to the devastation around us, but we can give that much a fuller attention, and therefore have a life where we accept its multitude of emotional experiences, the inevitability of loss and suffering.
It's always possible to make a contribution, no matter how much we may be suffering.
Up until a certain point, obviously, people who are semi-conscious or in a vegetative state may not get better, may not be. But for those of us who still have ability to choose the way we think, though it may require Herculean effort, we can choose to focus on that which still is good.
Dr. Debbie Joffe Ellis, thank you so much for sharing this powerful half hour on rational emotive behavioral therapy.
Thank you for inviting me and for your superb questions and your presence. Thank you, Jeff.
And thank you for being with us.
Thank you.